This is a PowerPoint presentation on stroke. So looking at the pathophysiology of stroke, we have something that involves a sudden interruption of the blood supply to the brain, whether that be from a blockage or a rupture. And this can lead to tissue damage of the brain, leading to neurological deficits.
So when we have a patient who's experiencing a stroke, that is an emergent health event. So our priority is going to be to assess their airway, their breathing, and circulation. We also want to conduct a focused history assessment, which should be conducted on all patients that are suspected of having a stroke. We do have a tool, the NIHSS. It's a standard tool to assess patients for stroke. So this tool is going to be used to determine what kind of things they're exhibiting and what nursing interventions could be executed. So we're looking for things such as their level of consciousness. Are they able to answer? Are they able to follow commands? What does their visual field look like? Do they have any facial palsy or motor dysfunction? Are they having trouble walking? Any sensory issues? And then if they're able to pay attention and keep attention with you. These are all very important things when determining a stroke.
Some common signs and symptoms of stroke to watch out for include numbness and weakness in the face, a change in mental status, trouble speaking or understanding speech, loss of peripheral vision, weakness in one side of the body or weakness in the lower half of the body, ataxia, which is an unsteady gait and the inability to keep your feet together, dysarthria, which is difficulty forming words, and dysphagia, which is difficulty swallowing. One of the scales we can use is BFAST, which is commonly available for use in homes and hospital systems and is a reference easily accessible for most people. Some diagnostic tests we can use include CT imaging. This is going to specifically look for ischemia in the brain tissue, whereas we can also use an MRI, which is going to give us a deeper look and can identify an arteriovenous malformation.
As for nursing interventions with a patient having a stroke, you're going to observe for neurological deficits with frequent or seriological neurological assessments. You're going to measure their pupil size. You're going to monitor their vital signs, keep the room quiet, and keep the head of the bed elevated. Keep the bed rails up to prevent falls. Leave the nurse call button at the side of the bed in case the patient needs to go to the bathroom. You're going to watch for seizures, watch for level of consciousness, provide DVT prophylaxis, and do a swallow eval. There are a few medical interventions that can be done for a stroke. The main drug used in the U.S. is known as alteplase, also known as TPA, and it has to be administered within 3 hours of the onset of symptoms or 4.5 hours if the patient does not meet one of the contraindications set forth by the American Stroke Association. There's also a surgical intervention that can be done called an embolectomy, in which a clot is retrieved and removed, or a stent placement.
Some information that would be good to include when educating clients is that a stroke is caused by an interruption in perfusion to the brain. Stroke prevention includes smoking cessation, limited saturated fats, eating fruits and vegetables, and getting regular exercise. Conditions that can lead to a stroke include high blood pressure, obesity, substance use, atrial fibrillation, high cholesterol, carotid stenosis, and diabetes. It is important to manage these conditions to reduce your risk. The AHA recommends following the FAST acronym to recognize the signs of a stroke, which include face drooping, arm weakness, speech difficulty, and time. Some population-specific considerations include Black Americans are more at risk for a stroke due to associated higher risk of high blood pressure, diabetes, and obesity. Hispanic populations are also at risk due to limited public health information availability in Spanish. Being elderly over the age of 60 increases your risk of stroke, but anyone can have a stroke. And clients with a low socioeconomic status are at a higher risk for stroke, receive lower quality care, and experience poorer outcomes. Due to inadequate control of cardiovascular risk factors, exposure to increased particulate air pollution, and disparities in healthcare.
Test your knowledge by either following the link or following the video. Pause as you need.
Stroke is A. Interruption of oxygenation to the heart, B. Interruption of glycogenesis, C. Interruption of oxygenation to the brain, D. Interruption oxygenation to the carotid artery. Their answer is C. Interruption of oxygenation to the brain. True or false? Strokes aren't deadly. The correct answer is false. Non-modifiable risk factors: A. Black American Hispanics, B. Male, C. Age, and D. Obesity. The correct answer is A, B, C. Modifiable risk factors: A. Smoking, B. 60 years or older, C. Hypertension, D. Diabetes. The correct answer is A, C, D. Conditions that lead to stroke: A. High blood pressure, high cholesterol, carotid stenosis, B. Obesity, substance abuse, C. Diabetes, AFib, D. Glaucoma, CHF, splenomegaly, and hyperkalemia. The correct answer is A, B, and C. True or false? People with low socioeconomic status are at higher risk for getting a stroke. The correct answer is true. True or false? Children and babies don't get strokes. The correct answer is false. True or false? Smoking is a risk factor. The correct answer is true. Signs and symptoms of stroke: A. Loss of balance, B. Speech impairment, C. Diplopia, and D. Difficulty breathing. The answer is A, B, and C. How do you diagnose a stroke? A. CTP, CTA, B. X-ray, C. MRI and MRA, D. NIHS. It's A and B. True or false? The NIH is a diagnostic tool. The correct answer is false. The NIHSS stands for A. National Instrument of Health and Stroke Scale, B. National Institute of Health Stroke Scale, C. National Institute of Hemorrhagic Stroke Scale, D. National Institute of Hemorrhagic and Ischemic Stroke. The answer is B. IV fibrinolytic is used for A. Hypertension urgency, B. Ischemic stroke, C. Hemorrhagic stroke, or D. Both types of strokes. The answer is B. Name of the IV medication used for ischemic strokes. The answer is D. Alteplase. True or false? Alteplase can be administered within 3 hours from the onset of symptoms. The answer is true. True or false? It's safe to administer Alteplase if blood pressure is 185/90. The answer is false. Surgical interventions for stroke: A. Neuroplasty, B. Embolectomy, C. Stent placement, D. Craniotomy. The right answer is B, C, and D. The client wants to know what they should do to prevent a stroke, and you answer A. Stop smoking, B. Exercise, C. Limit saturated fats, and D. Eat fruits and veggies. The correct answer is all of them. What is not part of the FAST acronym? A. Speech difficulty, B. Arm coordination, C. Tremors, D. Facial droop. The correct answer is B and C. Will you pass the NCLEX? You know the answer is a yes.